On behalf of the Centers of Medicare and Medicaid Services, the Administration for Community Living, and the Indian Health Service, I would like to welcome everyone to the Long-Term Services and Supports webinar series. My name is Amanda Fox, and I work for Kaufman & Associates. I will be the moderator for today's webinar. Before we begin, I would like to highlight the main features of your webinar interface. First is the main window, where you will see the PowerPoint slides. To the bottom right of the window is the Q&A pod. You can enter a question for presenters at any time in the Q&A pod. A Q&A session will take place after the presentation. Directly above the Q&A pod is a Files pod with a link to the presenter slides. To download the slides, click Download Files. This will pull up a new browser window with a link to download the slides. To return to the webinar, minimize the browser window. If you need technical assistance during the webinar, please enter your tech support questions in the Q&A pod. Our tech support staff will be monitoring these questions throughout the webinar and will work to answer your tech support questions right away. You'll receive an answer in the Q&A pod. Finally, please be aware that today's webinar is being recorded and that the recording will be made available online in the near future on cms.gov. With those announcements made, I would like to welcome everyone to today's webinar. Today's webinar is titled Finding Local Providers and Resources Through the Eldercare Locator. We have two presenters with us today. I will introduce each one. First, we have Patrice Ernest, who is the Director for the Eldercare Locator for the National Association of Area Agencies on Aging. Second, we have Cole Ward, a Research Specialist for the National Resource Center on Native American Aging. Thank you all for joining us today. I will now turn it over to Patrice to offer an introduction to today's topic.
Thank you, Amanda Ree, and I appreciate so much the opportunity to get to speak with everyone today and provide an overview of the Eldercare Locator. I serve as the Director of the Eldercare Locator, which is administered here at the National Association of Area Agencies on Aging. A little bit of background about the Eldercare Locator. We were established in 1991, and we are funded by the U.S. Administration on Aging of the U.S. Administration for Community Living under Health and Human Services. We are administered by the National Association of Area Agencies on Aging, and we serve as a trusted gateway to accessing information and resources that are crucial to one's health and well-being. And today, you're going to learn about how you can use the Eldercare Locator to access important information about local programs and services. A little bit of information about the National Association of Area Agencies on Aging. We are a nonprofit membership association representing America's national aging network of 622 area agencies on aging, and we provide a voice in the nation's capital for over 250 Title VI Native American aging programs. Our mission is to build the capacity of our members so that they can help older adults and people with disabilities live with dignity and choice in their own homes and in their own communities for as long as possible. Today's webinar is going to go over four main points. We are going to describe the Eldercare Locator and our services. We're going to provide you a little bit of information on the callers that call the Eldercare Locator call center and describe the service area needs that we so often hear from callers. Thirdly, we're going to provide, and this is the key area, we're going to walk through the Eldercare Locator and provide key resources and materials that you will find on the website as well as through the call center. And then lastly, we'll open it up to questions and answers and be facilitating discussion. I wanted to first start out by giving you a little bit of information on a recent survey that the National Association of Area Agencies on Aging conducted along with Miami University. This was released in 2017, and it provides an important look at the trends and key points about providers and services and programs of Title VI services. And as we hear the highlights of this report, you will see that many of these key points have a connection to the service requests that are so often requested by callers into our call center. A few highlights of this survey include the confirmation that tribal communities provide services and supports that enable elders to live safely with independence and dignity in their homes and communities. Title VI programs noted that their strengths included dedicated staff, the ability to provide quality services to elders in need, and thirdly, the ability to overcome challenges to deliver those services. Those challenges include covering vast distances, facing IT challenges due to factors such as lack of internet access, cell phone coverage, or appropriate equipment, and addressing the many needs of their community elders with limited resources. The majority of the Title VI programs serve a rural or remote population, and some of the Title VI programs provide services over large land areas or difficult terrain. Service delivery sites may be hours away from the program center, and these factors can often lead to increased costs of providing services. Through the surveys, many Title VI programs operate with limited staffing, and while most Title VI directors are full-time, they often split their time between Title VI program activities and other responsibilities. In regards to the services provided, many Title VI programs offer at least one elder abuse prevention or intervention service. However, elder abuse services are primarily funded through non-Title VI funding streams. This survey also found that the most commonly reported unmet needs include money management issues, home modification, chore assistance, and legal assistance needs. All of these are key points that are important considerations when accessing community-based services and programs. So now let's discuss the Eldercare Locator. As mentioned, the Eldercare Locator serves as a trusted gateway to accessing services and programs. We provide non-biased information on resources and services. The Eldercare Locator is a tool for elders and family members as well as professionals. And through our nation's national call center's toll-free hotline and website, individuals are connected to reliable local resources. A little bit about our operation here. We were established, as I mentioned, in 1991, and we are located here in Washington, D.C., and our call center operates Monday through Friday from 9 a.m. to 8 p.m. Eastern Standard Time. Since the beginning of the Eldercare Locator, over 4 million people have been connected to local programs and services through our national call center. Our callers contact the Eldercare Locator from all 50 states, the District of Columbia, and most U.S. territories as well. After hours, there is an after-hours voice prompt system that allows callers to have direct connection to the agencies that are open after normal business hours. So, for example, if someone was to call after 8 p.m. Eastern Standard Time here at the Eldercare Locator, they are able to either leave a message with us and we will call them back the next day, or they can actually put in their zip code area and be connected to the agency and learn more about that particular agency. Here at the Eldercare Locator, we have a team of 17 information referral specialists who answer our calls. They are all certified through the Alliance of Information and Referral Systems, or known as AIRS, and receive certification as a Certified Resource Specialist Aging and Disabilities. Our call center environment is very robust. We actually handle over 1,200 calls a day, and our average call time is 7 minutes. Over half of the callers to the federal agency, to the Eldercare Locator, are referred to us by another federal agency. For example, over 10,000 calls per month are referred to us by Medicare, the National Medicare toll-free number on average. We actually have a two-tiered system here at the Eldercare Locator. in that calls are handled through information and referral specialists, and then from many times those calls can actually be very complex, and we have enhanced services specialists who will answer those more complex and urgent calls. I mentioned we receive an average of 1,200 contacts a day, and those contacts, in addition to coming through our telephone line, are also coming through chats and emails, as well as written letters. Interestingly, chats have really expanded much higher than emails these days from callers requesting services. We have what we call a customer relations management system that we actually take information, very, very brief information. We do not collect any personal health information, nor do we collect information on names or contact information. We are actually asking a total of about 7 questions, asking the question of what their major service request is and how they heard about us, as well as, of course, their location. We do use what we call a taxonomy classification system so that we can actually keep track of those major calls that are coming to us. And then the Administration for Community Living approves the resources that we do provide for referral. We do spend a lot of time making sure that our information is accurate and up to date. And that's what I call a partnership approach. So today, as you look at the Eldercare Locator, if you see your information included in our database, we encourage you to give us a call, and we'll have the contact information there that you can actually update your information should you be listed on our system. Wanted to share now, secondly, a little bit of information about the calls, who's calling us, and what they're calling about, to give you a real good idea of the Eldercare Locator. I mentioned 1,200 calls a day that come into our call center, but what we also see is the call complexity that is increasing with those calls. No longer are we seeing callers calling with perhaps one request or one issue. Many times it's a multi-layered request, and that includes emergency situations, or in some cases crisis calls that come into our center. And again, those calls are escalated to our enhanced services specialist staff. We also have seen an increase in transportation needs. Transportation is our number one request that comes into the Eldercare Locator, and we have seen that transportation requests for medical appointments being the top request for transportation services. Additionally, there has been an increase for supportive in-home services, someone to come in and provide assistance with bathing and dressing, and sitter services are often requested by callers into the Eldercare Locator. So combined, these two service requests comprise 38% of all calls that come into our call center. We also experience unexpected events that continue to cause spikes in the Eldercare Locator. Most recently, those impacted by hurricane activity, and that those individuals who may need housing repair, for example, caused by hurricanes or weather-related issues. I wanted to share a few examples of the calls that come into the Eldercare Locator, medical transportation requests. And again, these are examples, but highlight really the calls that come in. An individual calling us because they are a long-distance caregiver, and they are very concerned about their parents not being able to meet their medical appointments because they are no longer able to drive and they have a need for transportation. Those requests for services also include those who may need to go to cancer treatment, cancer treatment. So again, those referrals would go to the local area agency on aging, or for instance, with the cancer treatment program, we may provide a referral to the American Cancer Society's Road to Recovery program. I mentioned in-home supportive services, again, really looking at those assistance with bathing and dressing and companion personal care services that are so often needed. And then lastly, we are seeing individuals calling because they have concerns about a relative perhaps who has been scammed in some way. And for example, an individual who has called because their parent received a call from someone claiming to be from Social Security and wanting bank information. Again, a scam type of call that we get. Those calls regarding Social Security are referred to Social Security offices, Inspector General, for reporting. So now we're going to go over to the Eldercare Locator website. And again, after this session, I do hope that everyone on this webinar will go ahead and go over and walk through the website by putting in your zip code, your city or state, and being able to look at the services that are available. Wanted to share a little bit of information about the services that are on the website itself, and I believe that we are going to the site itself. Before we navigate through the site, I just want to share a little bit of information about three main areas that the website provides. And one is education information. And if you go to the website, you will see at the bottom of the screen here where it says Caregiver Corner. That is a link to 15 of the most common questions that we receive from caregivers. So information on resources is available on that site with important links for caregivers, and again for professionals who are assisting those caregivers to locate local services and programs. You will also see that you have information about our call center. Individuals start an online chat right there. They can email us or they can, again, call. And then as we go down a little bit, you'll see the information that's available on certain topic information, such as housing, elder rights information, transportation, insurance and benefits, supportive services, and health information. Again, by clicking on that information, you can go to a lot of helpful resources and links. If we go back up to the top of the page here, you will also see at the very top, in the top right-hand corner, there is an area that is, you'll see Home, About, and the Resources. If you go to the About area, we won't go to it on this site, but please go to that About area. You will be able to see information about the Aging Services Network. It includes information about the Title VI programs that are available throughout the nation as well, too. And then, most importantly, we have the information on the Resources tab, as you can see there, and following our walkthrough of the system will highlight several of resources that you can actually use in providing information and outreach. So at this time, I'm going to turn the presentation over to my colleague, Cole Ward, and he is going to actually walk through providing information and walking through a particular zip code area.
Thank you, Patrice. I appreciate it, and I'm happy to be with everyone today. As Patrice had mentioned, I will walk through the Elder Locator today and use the zip code that I've already put in, 85147. And we can go ahead and submit that. And what we see is Scranton, Arizona. And we go through the list and results that show up, both state and tribal resources available to that area. As I go through it, we can see the State Agency on Aging, Elder Abuse Prevention, Division of Aging and Adult Services, Health Insurance Counseling, Legal Services, and then another one is Long-Term Care Amendments. But now if we go back up to the American Indian Tribes and Tribal Organizations in the Tribal Council of Arizona or the Gila River Indian Community Elder Services Program, we can also go to what we have called the Native Service Locator. And the Native Service Locator is funded through the Department of Administration and Community Living, ACL, and we're housed at the National Research Center on Native American Aging at the University of North Dakota in Grand Forks, North Dakota. One thing I will highlight here before I begin is to note the website address on the top left corner. And as I also go through this, we can see there are many different states represented here. And as we go through this, and if at a later time too after the presentation you want to go through your site to double check, I highly encourage, as Teresa had mentioned, and I echo her same thoughts, to update the information so we can get an accurate representation for our elders. But now we're looking at the Arizona area, and these little dots here on the Arizona map represent all the tribes that are represented that we have collected information with. And tribes are able to do this freely. It's encouraged, but they don't have to. It's encouraged. And we get the information through a survey, through phone calls. We have a research assistant, an undergraduate research assistant who works on this during his time here with us at the center. And we continue to update it and call it, trying to do as many tribes as we can a day. But we also do, as I mentioned, a survey. A survey we do send out during our needs assessment process, which is the flagship of our program, the Title VI Needs Assessment Survey. And with those surveys, we'll also send out another survey with Title VI directors to fill out and update the information. Now, another key thing that actually we just talked about this week that I am kind of excited about is the possibility that they may provide a link in this white area in the right-hand corner here for a survey called Qualtrics, So the Title VI directors can just go to our website and update it anytime they want, and it'll come to us. We can update it that same day. That's something that's being talked about. One thing I will say, the service locator is continuously being updated. So if some things look different, rest assured it is this website. Things won't change too drastically. The other thing I will mention, we do see a list here of the states, and these states highlighted in purple represent the states that have the tribes who participate with us. For example, Alaska has 13 villages. Alaska villages who participate with us. California has 15. Yes?
Before I had, I believe we had a question about Alaska. Could you go ahead and click on Alaska?
Yes. So this is the state of Alaska. As you can see, many of the Title VI directors who choose to participate with us are in that peninsula in the southeast. And we expect to update this continuously this year, as many of the needs assessments are due this December. And we're hoping to get back feedback through this survey. This is what the state of Alaska will look like. And then as an example, I can put on a tribe here. We can do Tana Chiefs. And this is what it will look like. The address, city, phone number, the Title VI director, email, hours of operation, and then the services provided. I think this is the time to share. We do get some unique phone calls here through participants. As Teresa had mentioned, we do get them from those who are taking care of their parents or grandparents and looking for resources. However, this is, as in my position, I don't necessarily know what every tribe provides or if there's monies involved or how that goes. So unfortunately, I'm unable to answer those specific questions, but I am able to answer the services provided. Some tribes do provide, such as adult daycare. Some even provide the nursing home assistance. But again, I don't want to speak for all tribes or Alaskan villages, but that does occur sometimes. The other thing I like to mention is there's a drop-down box up here. What services are you looking for? That I can highlight. Many of the ones that people look for, the congregate meals. So click that, it'll update and show the states that have tribes provide it, and actually go down even a narrow search and help you out there too. That's another neat feature that was added this past year. And again, I do want to say that this information is continuously updated. We have an undergraduate research assistant who does update it. Actually, this week we got surveys in. We were able to update it through that process. Another one we can do is home repair, home modification. That's another big one that people call and ask. And again, I can show you the differences. Those are the states that have it, states that don't. Click in Alaska, since that was one of them. So 2 tribes, 2 villages indicated they provide home modification for the state of Alaska when we did their Title VI interview with the Title VI directors. Another neat thing here that I almost overlooked was that this map is color-coded for those reasons that we see the beige color, the white color, if you will. That indicates that there's no tribes who currently participate, or the states do not have any tribes that participate with us in the service locator. And then, of course, the yellow, orange are 1 to 2 centers, green 3 to 4, blue 5 to 10, and Alaska 11 to 4. And again, I want to stress this does not represent every tribe within those states or those boundaries or Alaskan villages within Alaska. However, that being said, I think that goes through it. And I encourage you to note the web address here, and please call us, as Teresa had mentioned, if there's anything that's not updated or of services out of place, or a new Title VI director has taken over, we'd like to keep that current for our tribal elders. Thank you.
Thank you, Paul. And you can see how critically important that link is on the Eldercare Locator to locate, to actually provide that linkage with the National Resource Center on Native American Aging. I'm very excited to be working with Paul and colleagues to be able to have that link to on the Eldercare Locator. It's such an important resource tool. Just to, again, to be able to emphasize the service listings that you can actually find once you put either your zip code or your city and state into the Eldercare Locator site. We have 9 major service provider listings, and I want to go over those so that everyone understands on this webinar what those major resources are. They include information and assistance programs. Secondly, aging and disability resource centers are listed, and as Cole highlighted, the name, address, telephone number, hours of operation are on all of providers here. All of the area agencies on aging, all of the Title VI Native American, Alaskan Native, and Native Hawaiian programs are included. Each state unit on aging, a very important resource are the Adult Protective Service information numbers that are listed under Elder Abuse Prevention. The Health Insurance Counseling Programs, known as SHIP, are provided on the site, as well as Older American Act Legal Service Program, and as Paul mentioned, the Long-Term Care Ombudsman Program. So again, when you're putting in the zip code or the city and state, you're going to have access to that information. I will share that we do get a lot of calls from local providers that want to be listed on this database, and we do not list local providers, for-profit or non-profit on a local level, because again, that is where that information is going to come from the area agencies on aging or the Title VI organization. So at a federal level, at a national level, we want to get callers and caregivers to their local resources. But again, a critical tool not only for those calling us and their caregivers look for professionals as well. I hope that everyone has a link to the Eldercare.acl.gov website. If you have a website and with resource information, please add our link to that site as well. Want to share a little bit more information about the Caregiver Corner. I mentioned that the Caregiver Corner provides answers to some of the most critical questions that come into our call center. For instance, question number 3, can I get paid for caregiving? We often get questions about caregiver compensation programs. And again, that is where we're going to refer individuals to their local area agency on aging or Title VI organization, since those programs may vary from state to state. My father is a veteran. What programs could he or his spouse be eligible for? And again, we're going to refer to the VA Caregiver Support Program and also to the area agency on aging, Title VI organizations, or other local agencies. This is a question, for instance, that is on the site regarding transportation. Regarding adult protective services. And again, so important to know that adult protective service information is on this website. We do a quarterly update to make sure that the information is current and accurate of all adult protective service information. But you can see here from this example, we're sharing that in the event of emergency, to call 911, and then, again, we provide the link for the database to connect to adult protective services. This is the example on transportation. Again, we're referring individuals to their local area agency on aging, making sure that they know about the National Family Caregiver Support Program. And again, encouraging individuals to provide their zip code or city and state to be able to search for those local resources. And this is the area, again, that Cole showed you that provides information about some of the key services and programs that are related to aging services. I also want to show you here that we do provide links to Medicare.gov, the National Institute on Aging, and you can see here Family Caregiver Alliance for those who may be caring for an older adult. Again, this is the section that we talked about at Come Up, and you will see the resources section here, and you will see all of the wealth of information that we have for links, the Caregiver Corner, contact information about the aging network is provided on this site as well. These are the 9 major service areas that we just discussed. And again, please go in and check out your area, check out a zip code area, see the information that's available for your area. We often have people who call us and are asking about how do they update their own information. And as Cole mentioned that they are going to be looking at providing a link to their site. If you are going in and you are looking for information that needs and find that something needs to be updated, I would like to give you our website or our email address to be able to email us, and that is elcb@n4a.org, and we will be glad to update information. Most often what happens when we do get a request, we will call you just to confirm that information, make sure everything is accurate and up to date. I want to switch now to the area of the website that provides consumer publications. There is a wealth of information on the Eldercare.acl.gov website that can be so helpful for individuals who are providing training or those that are just looking for very specific publications on different topics. These are some examples of the publications that are available on the Eldercare.acl.gov website. They include brain health activities. Again, since our number one call is primarily related to transportation, this brochure on giving up the keys addresses the issues of individuals who are no longer able to drive, what resources may be available there. Our Expand Your Circles brochure was produced during our Home for the Holidays campaign, where we addressed the issue of social isolation and loneliness. And again, this brochure has helpful information on ways to connect and become engaged in local communities. The guide to benefit for seniors brochure was produced in conjunction with the National Council on Aging, NCOA, and provides very good information about national programs and benefit services that many seniors may not even be aware of. So again, that is available for downloading on our website. This is our main brochure for the Eldercare Locator. There is a version of the brochure, again, that you can download, that you can actually put your information in for a local contact, or again, if someone is concerned about someone in another area of the country, they can call our toll-free number or go to our website, and that is available on that brochure as well. Several of our brochures are also available in Spanish as well. Two recent updated brochures include Protect Your Pocketbook. I mentioned earlier about the calls that we have been seeing an increase of scam calls. This particular brochure provides tips to avoid financial exploitation. And Preventing Falls at Home, a very helpful brochure regarding ways to really look at safeguarding your home to prevent falls. Transportation Options for Older Adults and People with Disabilities is a brochure that we produced in conjunction with the National Aging and Disability Transportation Center, which is located here at N4A, the National Association of Area Agencies on Aging, and provides good information about various transportation options that may be available in local communities. Living Well with Dementia in the Community was our last year's Home for the Holidays campaign, and really focuses on how do we support communities and individuals and those caregivers of individuals with dementia. Again, available for downloading on that resources section of the database. I want to spend just a few minutes on our most recent fact sheets, because these are very easily downloadable fact sheets that are available on the resource page of the website. Older Adults and Elder Abuse is, again, a one-page helpful piece that really shows information about how to spot elder abuse, what types of elder abuse, ways to prevent elder abuse. Again, you can download these, make copies of them, and very easily printable fact sheets. The second one we provided was helping older adults weather the storm before, during, and after disasters. That publication was produced in conjunction with FEMA. And again, important information of how to prepare for possible disaster situations. And then lastly, our publication on older adults and medication safety. This one provides tips for wise use of medication, also provides information about prescription opioids, and provides information about how to take the store medication, again, available for download. Wanted to share a few minutes, if I can, about the last Home for the Holidays campaign that was just recently completed in 2000. Every year during the holiday season, towards the end of the year, the Eldercare Locator has focused on a major issue or a topic that is a sensitive topic that can really be a time during the holidays when families gather to be able to be a tool, perhaps, to be able to share information. This last one really focused on those long-distance caregivers. Our campaign usually provides outreach to the media and really trying to highlight an issue. One of the issues that individuals were very surprised to learn, and we had many callers that really were surprised when we shared through the National Alliance for Caregiving statistics that if you live more than an hour away from the person that you're providing care for, you are a long-distance caregiver. And many individuals were surprised to think that they were actually a long-distance caregiver. And some of the challenges that long distance really is very difficult for a long distance caregiver. So this brochure again is available for downloading. So with that, this is our toll-free number, 1-800-677-1116. Our website, of course, is Eldercare.acl.gov. That is a new website address. If you have the old website, which was Eldercare.gov, we encourage you to change it to Eldercare.acl.gov. That is the new secure website for the Administration for Community Living. And at that point, I will turn this back over to our moderator for questions.
Hello, everyone. This is our time for questions. Please enter your questions in the Q&A pod, located at the bottom right side of your screen. Our first question is, Patrice, can you repeat the contact details for information updates?
Sure, I will be glad to, and thank you to whoever asked that question, because as I said earlier, we're really a partnership in providing this accurate information, and we rely on our Title VI providers, our area agencies on aging, our ombudsman, and our SHIP programs, all of those providers to make sure that our information is as current and as accurate as possible. So that website address is ELDC@n4a.org. And that, I said website, but it's actually an email address. That comes directly to us. We receive those emails, and then we will contact you to make sure your information is correct and accurate.
All right, our next question is it possible to request this elder care presentation for my group of care managers?
Sure. Yes, I believe that this is being recorded, and of course, I would think that would be available. Am I not correct on that? But if anyone also has any questions about the Eldercare Locator, we'd be glad to work with someone on making sure that they are aware of the wealth of information that the Eldercare Locator provides.
Great, thank you. Can you go over the long-distance caregivers program?
Sure. It actually, when we say the long-distance caregiver program, I'm referring to not necessarily a program in and of itself, but the fact that so many caregivers find themselves in long-distance caregiving situations and challenges. And so our Home for the Holidays campaign really highlighted the issues that long-distance caregivers have. And the brochure that we have is really a helpful brochure to make sure that long-distance caregivers know about the Eldercare Locator, number one, because sometimes individuals may say, I just don't know where to start or where to begin, especially if you're traveling, across states, because so often individual programs may vary from state to state. A good example of that is many times that the Eldercare Locator will get calls from individuals who want to change, quote unquote, change their Medicaid, unaware that Medicaid programs vary from state to state. So our long-distance campaign is really an effort to make sure that individual caregivers are connected to the local resources That's where they're going to find information about those services in this program.
Are there any more questions at this time? All right. I would like to thank Patrice and Cole for joining us today and sharing information about the Eldercare Locator. In closing, I would like to remind everyone that today's webinar was recorded and the audio and presentation slides will be made available online at cms.gov on the Tribal LTSS Technical Assistance Center website. Thank you again for joining today's webinar. Our session is now concluded.